Hey guys, this is Brandon Barbell Therapy. We're going to go over now is a hip flexor or Psoas release to improve. It's going to improve hip pain, maybe some low back pain, improve the mobility throughout the hip. So what we're going to do, and sometimes too people think if something's really tight, we need to stretch it and bring it further apart from one another, and that's somehow going to make it feel looser, which I think is the other way around actually, where if we bring something closer together, it's probably going to feel a little looser. So with this technique here, what we're going to do is we're going to flex this knee up, put our foot flat, we're going to relax that leg, and what I'm going to do, and this is a self technique that you can use at home, now beware, we are going in through the abdomen here. It should be light pressure. We are not digging into that. It's very light. It's a soft fist just in here. So what we're going to do is you're going to find your belly button. You're going to come about 2 to 3 inches off that, just over where you can feel the bulk of your abdominal muscle. So it's right off to the side there that we're going to place the bottom of this kettlebell, and we're just going to let it rest there. So Sam's going to hold that on his own here, okay? And now, if you were ever to feel a pulsating sensation or anything like that, please stop, consult a medical professional, and learn how to do this in person and what you should feel the right way. So what Sam's going to do is he's just going to hold that there, and I typically use a 15 to 20 pound kettlebell to do this. Again, I'm not pressing in. It's a very sensitive muscle that responds very well to light pressure. So all Sam's going to do is he's going to take, and the key here is breathing, so he's going to take a big breath through his nose. He's going to fill his belly up like a bear belly. So don't be afraid to push out, because that's what we want. And then he's going to take a 5 to 8 second exhalation or breath out, very slow through his nose. And the key here is at the end, he wants to pause that breath. So hold that exhalation for 1 to 2 seconds before he inhales again. So the whole purpose of this is getting that hip flexor to shorten up, and then with some light pressure, we teach the brain to inhibit it. And the breathing is a big part of that, because that slow, long, deep breath out is what's going to get the brain to relax more, and it's going to get that muscle to relax more. So if you do the breathing too quick, this drill might not work. So please take the extra few seconds each rep to perform this with a slow, long, relaxed, deep breath out. And so I typically do this about 5 to 6 times, or 5 to 6 breaths. So one more. Long, slow, deep exhale. Good. Hold the exhale. Good. Relax. Bring that off. And then typically, if we retest hip flexion, that's actually a lot looser. So we can retest hip flexion, and he can take his hands and hug that knee to his chest. I'll typically have you do this about 5 to 10 times, is just rock that knee back and forth 5 to 10 times. So give it a nice firm hug. And then if you recheck hip extension, that typically can improve as well. And the hip might just feel more mobile overall, and also notice if your back feels any looser or less restricted. So go ahead, give that a try. Let me know if you have any questions. Thanks for watching.